Hello, armchair epidemiologists, and welcome to Epi with Emma. Today I have a special guest. Hi, Jamie.
Hi, my name is Jamie Bozier. I'm a university maths student and I'm going to talk a bit about the spread of worm diseases, how we control them, and why it matters. When people think of diseases, our minds often jump immediately to deadly diseases, such as Ebola. However, there's a whole range of diseases which are not fatal but can still cause serious health issues. For example, there's a class of diseases caused by parasitic worms which may not cause death but can result in long-term illness and even permanent disability. These disabilities can make it difficult for individuals to find work and lead normal lives, exaggerating the effects of poverty in countries with limited healthcare access. Caring for and treating people with disabilities is also expensive and puts a lot of pressure on existing health services. This means it's important to work out how much government should spend on treating these kinds of diseases. Worm diseases are quite different from some of the other diseases you may be familiar with. For example, with the common cold, people are either infected or not infected. The infected people may become ill for a couple of weeks and then will recover from their symptoms. However, with worm diseases, different people can have different numbers of worms inside them. The worms can often live for a number of years, causing long-term symptoms. The risk of disability is dependent on both factors. That's how many worms an individual has and how long they live for. Monitoring worm levels in the population over time can help governments estimate how many people might develop disability. So what can we do to help? We have drugs that can kill the worms and stop them reproducing. And the easiest way to reduce worm levels is to treat everyone in a population. However, it's difficult to treat everyone, so we aim to treat as many people as possible, often once a year. Governments have to balance the number of times treatments are given with the costs of providing those treatments. Let's look at a couple of examples to explore this further. Imagine a community with high worm levels and a government that decides to do one round of drug treatment. As people take the drugs, the worm levels in the population will decrease. The size of this decrease is dependent on how many people will have been able to take the drug and how effective it is at killing the worms. We initially see a big decrease in worm levels, but after some time the remaining worms will reproduce and the disease will bounce back to previous levels, meaning lots of people are still at risk of disability. Instead, the government might decide to do a round of drug treatment every year. In this scenario, we will see the worm levels repeatedly decrease as the treatment continually kills more and more worms. Eventually, all the worms will die out and there will be zero disease in the community. However, this would mean we have to keep paying for treatments forever, unless we knew when the worms had all died out. So what about something in between these two scenarios? After some number of years of treatment, there won't be enough worms to maintain the population. This is because a person must have 2 worms for them to be able to reproduce. This means eventually the disease will die out, even without any further treatment. So if we know when this point has been reached, we can stop treatments to save resources and prevent spiralling costs. This balances the cost of treatment and the health benefits for the community, making it a better option for policymakers. Mathematical models can be used to help determine when we should start or stop treatment, using methods like those described in the Epidemics mini-series. So in summary, understanding the biology of a disease is crucial when thinking about reducing negative effects such as long-term disability caused by worm infections.
Epi with Emma. Maths made simple.